Hi everyone. Thank you for returning to the channel. Today, we're going to discuss multiple sclerosis, or MS, a subject that is very significant yet sometimes misunderstood. We'll go over what MS is, how it affects people's lives, warning signs to look out for, how it's diagnosed, and potential therapies. Please press the bell symbol, subscribe, and give this video a thumbs up if you think it's useful so you can see our most recent material. Now describe multiple sclerosis in more detail. This disorder occurs when your immune system unintentionally targets the myelin sheath that surrounds your nerve fibers. This harm interferes with the communication between your body and brain. Let's examine how all of this manifests in daily life. There is a wide range of MS symptoms, and they can vary greatly from person to person. Here are a few typical and uncommon symptoms of multiple sclerosis that you may encounter. 1. Weakness. It's not only that you're exhausted. Deep, unrelenting weariness that may make even the most basic chores seem impossible is known as MS-related fatigue. It presents a significant obstacle for many MS patients. 2. Ocular issues. It is possible to have problems including double vision, blurry vision, or even momentary blindness. This is frequently caused by an inflammation of the optic nerve known as optic neuritis. 3. Tingling and numbness. It's possible for your face or limbs to feel tingly or numb. Anything from a little pins and needles feeling to more severe numbness that interferes with daily activities can be this. 4. Muscle weakness. Having weak arms or legs might make daily tasks more challenging. Additionally, it may impair your coordination and balance, making simple tasks like walking or climbing stairs difficult. 5. Difficulty walking. Unsteady stride and frequent falls might be caused by balance and coordination impairments. Some individuals may require assistance technology, such as walkers or canes. 6. Changes in cognition. Your memory and reasoning may be impacted by MS. Problems relating to focus, memory, or problem-solving skills might affect your day-to-day life and job. 7. Intestinal and bladder. Dysfunction. Control issues related to the bladder and bowel are frequent. This might indicate sudden needs to urinate often or constipation problems. 8. Changes in emotions. Emotional distress can be a result of having MS. Anxiety, despair, or mood changes are possible. It is essential to address these emotional factors if one wants to be well overall. 9. Spasms in the muscles. Muscle contractions that are not voluntary might cause being uncomfortable and limit your range of motion. Medication and physical therapy are two possible treatment choices. 10. Sensitivity to heat. Many MS sufferers find that being in the heat exacerbates their symptoms. This could be the result of warmer temperatures impairing neuronal activity. 11. Issues with speech. Speech problems brought on by MS might make it difficult to speak coherently. Speech-related muscular weakness or problems with coordination might be the cause of this. 12. Difficulties in swallowing. Swallowing issues can make eating and drinking difficult. This is frequently brought on by poor coordination or weak muscles. 13. Dysfunction, sexual. MS can affect a person's ability to have an orgasm or arousal, which can result in a decreased libido. Personal well-being and close connections may be impacted by these problems. 14. Vertigo and dizziness. Vertigo, a spinning sensation, or dizziness, are experienced by certain persons. This may throw off your equilibrium and raise the possibility of falling. 15. Pain. Another problem that some MS patients have is chronic pain, which can include musculoskeletal or nerve discomfort. Medication, physical therapy, or other therapies may be used to manage this discomfort. Identifying MS symptoms might take some time. This is what often occurs. 1. Medical background and neurological assessment. In order to evaluate your symptoms, your doctor will first go over your medical history and do a neurological exam. 2. MRI, magnetic resonance, imaging. MRI scans assist physicians in searching for plaques or lesions in the brain and spinal cord. These may be signs of damage from MS. 3. Torn ligament. This entails removing a sample of cerebrospinal fluid from your spine in order to check for certain biomarkers linked to multiple sclerosis, MS, and indications of inflammation. 4. Potentials that are aroused. These examinations assess the speed and effectiveness with which nerves respond to stimuli by sending out signals. They aid in locating any delays brought on by MS. 5. Heart examinations. Blood testing can rule out other illnesses that have symptoms similar to MS, even if there isn't a conclusive blood test for the disease. There are several therapies available to control the condition and its symptoms, even though there is no known cure for multiple sclerosis. Here are a few of the available treatments. 1. Medications that modify disease, DMTs. These drugs decrease the course of the illness and help lessen the frequency and intensity of MS episodes. Among the choices are interferons. These medications, which include Rebif and Avonex, aid in modifying the immunological response. Acetate, Geltramer. This drug, sometimes referred to as Copaxone, regulates the immune system and protects nerve fibers. Oral medications. More recent choices with the ease of oral administration, such as fingolimod, Gilenya, and dimethyl fumarate Tecfidera, provide efficient treatment. 2. Hormone extracts. These are frequently used to treat acute relapses by easing symptoms and lowering inflammation. 3. Symptom management. Additional options for treatment might be muscular spasticity. Physical therapy and medications like baclofen can help control muscular stiffness and spasms. Pain. Acupuncture, physical therapy, and prescription drugs may all be used to manage pain. Bladder and bowel issues. Bladder and bowel problems can be managed with a variety of therapies. 4. Treatments for rehabilitation. Speech, occupational, and physical therapy can help with everyday chores, increase mobility, and solve communication difficulties. 5. Discipline and assistance. Symptom management can be assisted by a healthy diet, consistent exercise, and stress-relieving hobbies. Having the support of friends, family, and support groups is extremely essential. Thanks for tuning in to this detailed look at multiple sclerosis. I hope this video has given you a clearer understanding of the symptoms, diagnosis, and treatments for MS. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and share it with anyone who might benefit. I'd love to hear your thoughts or questions, so drop a comment below. Until next time, stay informed and take care.